So I am Benita Coe, and welcome to my book launch party, Saturday, November 30th, 2024. I am joined by my astute assistant, Monique, who will be helping me with this presentation, but I wanted to talk about my new book that has been in the works, How to Help Your Doctor Help You, a guide for men and women to manage health proactively. On the welcome screen, you saw the QR codes for being able to purchase the book on Amazon, Books A Million, and Barnes & Noble, which I will show after we go through this presentation and book talk. And I also am going to make this very interactive. And so this book has been in the making for at least 15 years. And so this book is an outpouring from myself, and it comes from all the information and all the interactions that my patients have poured into me that I wanted to deliver to the world, and in an attempt to reach more people than the patients that I've seen over my 27-year career as an internal medicine physician. And so this book initially started as I would jot down things that my patients would say that I thought were profound, to try and collect things that patients would say to me that I could help the next patient. And I started jotting things down on a sticky pad and putting in my white coat, and then transferred them at some point to a notebook and then to a document. And then I saw all the things that I was recording from this very smart things that my patients would tell me over the years. And I said, this is turning into a book. And then I started with chapters, and then sometimes I would dictate in my car after a full day of seeing patients. And this process of writing this book has been going on at least for the last 15 years. And so now I have the final product. And so my desire in writing this book is to try to give the world information about things that I wish that they all knew when they came to see their primary care doctor. If I had $1 for how many times I would say something to a patient and they would say, "Why has nobody ever told me this?" And after a while, after hearing this a lot, I would say, "Yes, why do people not know these things?" And then it occurred to me that it's not written down anywhere. Simple things that make a big difference in how you can empower yourself to make better life choices, do things that so when you show up to your doctor, whether in person or virtual, you can come and be an active participant instead of a passive participant in your health, which really improves the care that your doctor can give you. And so the initial title of this book was Pearls from My Patients. But as I started adding and adding and adding subject matter, I changed it to How You Can Help Your Doctor Help You. And then in addition, I started adding to the topics in the book, the big three. I would say big four: high blood pressure, diabetes, high cholesterol, and making healthy food choices. And I've added information about how to lose weight. So this book is full of um, tangible checklists that you can use and practical things that you can do every day in your life to make better lifestyle choices to impact your health over the longevity of your life. And the next component in this book, I focus on more mental health issues, not from a clinical psychological standpoint, but making people aware about making healthy life choices and how that can impact your health. And so my favorite chapter in the book is called Through the Decades. And basically what that is from my perspective as an internal medicine physician, taking care of patients from adolescent years all the way to more seasoned years. All of the different stages that people go through in life, and giving a summary of the kind of issues that come up with each decade in life, life issues, health issues. So if you're somebody in their mid-30s reading this book, I'm giving you a perspective on what to look out for as time goes on, what to anticipate as far as the curves that life throws you. And in this way, you can make more proactive choices if you start thinking about what may be coming in your life before it actually happens. And so I liken life to being on a river. And so if you're on a river with a lot of different tributaries, you come to a fork in the river, just like in life, and you have to decide, am I going to go to the left or am I going to go to the right? And the choice on the left may be the choice that you know you should make. But you're younger, you're not as experienced. The pathway to the right is probably more fun, more intriguing. So you make the choice to go to the right. But the problem in life is once you make that choice to go to the right, this is a river that's only flowing in one direction, just like life. So once you make choices in life, sometimes, many times, you cannot go back and reverse choices. And so why am I talking about this as an internal medicine physician? Because a lot of times life choices that patients have made impacts their health, and we are talking about it during their medical visits. And so that is a basic summary of what this book is about. And it is I recommend it as a comprehensive reference to go over and just make sure that you are doing all you can to optimize your health. The one thing I think is unique also about this book is that I have a lot of references to websites to get you more information, get you going down multiple rabbit holes. And in the back, in the reference section, I have all that listed with the corresponding QR code. So it will be easy for everyone to read the book, not necessarily in order, and you can go to the reference section and find those links for more information. And so what I would like to do is have my guests to this webinar today answer some poll questions. And the point of the poll questions is to get into some of the topics that I address in this new book that I'm sure you're all excited to read. So Monique, I want to go to the first poll question about medical history. And so this first poll question gets to a common issue, a very big issue when you are taking care of your health. And the question is, do you know the complete medical history of your mother and father? And the reason why I spend a lot of time in the book on this issue is that many people do not know their medical history of their family, specifically mother and father, but even grandparents. It's very important to know that medical history because a lot of what you may be dealing with as a patient, as a person, may depend on the medical conditions that your mother and father have or had. And so if you look at the answers that we're getting from our guests today, we do have some people here who answered no, that they do not know their medical history of their mother and father. Sometimes if you're adopted, you won't know if your parents pass away, if you don't know. So for the younger people reading this book, I encourage you, your parents are still living, encourage them to discuss with you the medical conditions they have over the course of their life. Now, I am aware that many people have parents who don't want to discuss what their medical history is. So in this book, I give some tips on how to get that information from your parents, because sometimes people don't like to talk about it. But it's very important to encourage and try to get that information from your family members. So that is the one big topic that impacts many people's health that I wish people would know more of when they came to see me, seeking me to be a partner in their care. And so the next poll question is called Your Medical History. Now, this one may seem obvious, but it's not so obvious. So the next poll question, Monique, if you could put that one up, Your Medical History. And the reason why I made a dent in discussing this in the book is because a lot of people come to me and don't know their medical history.
Dr. Cole, if you could launch it, I'm having an issue here.
All right, let me see if I can do that. All right, let's see. All right. It is not letting me launch it either. Wonder why. So I'm just going to read the question. So the question is, and you can put the answer in the chat. Do you have a file where you keep all of your medical information at home? Be honest. Do you have a file where you keep all of your medical information at home? And the reason why I go over, oh, here we go. Now it's letting me do it. So if you could answer that for me, and let's see what our guests have to say about this. Somebody answered yes. Some people have answered no. Many people do not have a file at home where they keep their medical information. So the reason why this is important, because when you come and see your doctor, especially as a new patient, your doctor is supposed to be going through a medical history with you. And many times people don't know what surgeries they've had, what medicines they take. And obviously, if you come to your doctor and you don't know your medical history, you're really hindering the ability of your doctor to take care of you. And so, as you can see, we have some people who have answered no, that they don't have a file for their medical history. We have one guest who said that they have a file, but on the computer, which is just as good. But it is definitely important for you to know your medical history. As you get older, your history becomes longer and longer. And so that's why having a file is very important. So prescriptions, surgeons, specialists you've seen, ER visits, urgent care visits, lab results. It's all important to have that. So when you meet your doctor, you can have that information for your doctor. All right, so we're going to go to, so I spent a good amount of time in the book talking about that and explaining why that's important. And so we're going to go to the next question. Blood pressure. Let's see How many people can answer this question? Which is an optimal blood pressure? Is it 140/90, 130/80, less than 120/80, or 130/85? Let's see who knows the answer. And the reason why this is important, I spent a lot of time in the book talking about high blood pressure because high blood pressure is what we call the silent killer. And lots of people walk around with high blood pressure and don't know it, and it can wreak havoc in the arteries in your body. And so I meet a lot of patients over the years, 27 years of practice. At this point, I probably have thousands of patients that I have seen. And so high blood pressure, many people have, and they don't know it. And if you're walking around with high blood pressure, you're damaging the cells in the important organs of your brain. And once a lot of that damage happens, just like that one-way flowing river, sometimes you cannot reverse those effects. And so optimal blood pressure is less than 120/80. Acceptable blood pressure should be consistently at least less than 130/80, but optimal blood pressure is less than 120/80. So most of our participants got that answer correctly. And so I spent a deal of time in the book going over the nuances of high blood pressure. And the next question is about diabetes screening. This is the other big topic with respect to maintaining health. And the question is, do you know what your hemoglobin A1C is? Well, first of all, you have to know what a hemoglobin A1C is. So the hemoglobin A1C is how much sugar is stuck on your red blood cells. It gives us information about what your blood pressure control is over the last 3 months. And so just like high blood pressure, you could be walking around feeling fine, having prediabetes and diabetes, and having diabetes is a big risk factor for heart attack and stroke. So everybody here knows what their hemoglobin A1C is. That's wonderful. And so diabetes screening in adults should be done at least every 3 years. Often, if you have other things going on, we check it more often. And if you have diabetes or pre-diabetes, obviously we're checking it more often. But I meet lots and lots of people who don't know what a hemoglobin A1C is, and it's very important to know, and for starters, what your hemoglobin A1C is. I go through a whole chapter or two in the book about all the preventive health things that you should have based on your age, and knowing what your blood pressure is and knowing what your diabetes or pre-diabetes status is number 1 and 2. That's very, very important. So we're going to go to the next question on exercise. Let's talk about exercise. What is considered the minimum amount of recommended exercise for an adult? Is it moderate intensity exercise, 60 minutes a week, 90 minutes a week, 120 minutes a week, or 150 minutes a week? And when moderate exercise is something at least like power walking. And what I tell people, if just go outside and walk, call somebody on the phone. If you're able to carry on a conversation, that means you're not walking fast enough. How much exercise is what we are considered adequate for an adult? And so this group is pretty sharp. The answer is 150 minutes per week. So walking, on a treadmill, outside, biking, anything that's going to get that heart rate up. Now, this is where the book turns and gets real interesting. The next question we're going to is food. Food, number one, the first question about food. This is where I spend a good amount of time in the book talking about food. The best thing you can do for yourself and the best way you can help your doctor help you is turn over a new leaf and start making healthy food choices for the duration. So the first question is that bread, rice, pasta, and white potato challenge. How often do you eat bread or anything made with any flour, any rice, any pasta, or white potatoes? White potatoes means white in the inside, not the skin. And so we have answers 1 to 2 times per week, 3 times a week, 1 to 2 times per day, 3 times per day, or more than 3 times per day. And so we're getting multiple answers. So some people are saying 1 to 2 times per week, and we're getting the gamut to 1 to 2 times per day. And we got some more than 3 times per day. And so for most adults in this country, bread, rice, pasta, and white potatoes are the things that I'm telling people to stop eating. I know that's the things that people love to eat, but it really gets you into trouble with trying to prevent prediabetes and diabetes, and for the many people trying to lose weight. So I go through a good amount of time in this book talking about how to make healthy food choices, tips to make healthy food choices, and how to incorporate healthy eating into your lifestyle, because it is a whole lifestyle change. You have to make the lifestyle change, and also the people you live with, which is sometimes challenging, but for many people, sometimes I have to work with them and their family members to get everybody on the same page, because it's so much harder to make those healthy food choice changes when everybody in the household is not doing that. So so that's bread, rice, pasta, and white potatoes. I go through a good deal of time talking about that, and sugar. And so let's go to the second food question. How often do you eat a serving of vegetables? And distinguished guests, I meet so many adults who do not eat any vegetables ever, or rarely eat vegetables. And so that, for many people, is a big lifestyle change, how to incorporate those vegetables into what you're eating every day. And so we're getting answers 1 to 2 times per week, 1 to 2 times per day, 3 times a day, more than 3 times a day. And so the more you can eat vegetables, the healthier you can be, eliminating the starches and the sugar for many people, and getting rid of those things that can negatively affect your health. And the point of all this is to prevent any medical illnesses that you can prevent. So we know that genetics plays a part in many diseases that you can get, but any medical condition that you get, many times, more often than not, I'm also telling people to improve their eating habits, and that can improve your medical conditions. And now we're going to go to the last question, because this is a big bulk of what we deal with as internal medicine and primary care physicians, is dealing with all those life choices that can impact your health. So we're going to go to the life choices affecting health question. And this is a free text question. Name one past life choice that you would change that is currently negatively impacting your health today. Let's see how this poll question is going to work. You can type this in, Or if not, you can type it into the chat if the poll question doesn't work. But the point of all of this question is to have people consider on a day by day, minute by minute, month by month, year by year task of paying attention to the life choices you're making. And so what kind of life choices am I talking about? You can put things into the chat because we have removed everyone's name. Where you live, we've talked about what kind of food you eat, what job choice you pick, who your friends are, who's in your circle. Do you have kids? Do you not have kids? Who you decide to marry? And I have a whole chapter going over all of those life choices that I have discussed with patients over the years that bleeds into your medical visits and affects your health. And so, let's see. I don't know let's see how I can see the answers to this. If you don't mind putting your answers in the chat, if you would like to, about not enough sleep, someone answered. Yes. Not getting enough sleep is a big proponent or component of how you feel, how you make choices when you're awake. Poor stress management. Thank you for putting your answers in the chat, because the poll didn't show up on the screen. Lack of athletics as a child. Oh, going back to childhood, did music. Gaining weight every year. Say no to craving for sugar, rice, bread, and getting more sleep. Poor stress. All of those are excellent answers to choices that you make in life that can affect your health going down the road. Not enough exercise as an adult, sleep, less sugar. Yes, you're speaking my language. This is what I do every day. Let me add some more. How you treat people. That is a big one. You might not intuitively think that how you treat people can affect your health. But let me tell you, when you don't have to actually be old, but when you have a health problem or a health challenge and you have gone through life and have made choices about relationships with people, I have so many patients when they need others, they can't find anybody to help them. And the reason why I know this, because they tell me when I ask, well, where's your parents? Where's your cousins? Where are your friends? And they explain what has happened with their relationships in life and how they have regretted how they have treated people and how people don't show up for them when they need to because they have not shown up for people in the past. And so these are all kind of discussions that bleed into a doctor's office when we're talking about health. And so people have responded, not learning what's healthy to eat, too many drugs and alcohol. That's a big one that can affect your health later in life. Self-compassion, making others feel comfortable is a comment that one participant added. So yes, these are all things that I go through in the book. And so I weave into the narrative in my book, scenarios from actual patients, and the things that they have told me that I want the rest of the world to know. So I have changed the identifying information for the patients, obviously, so you can't identify patients by what I say. And some of the scenarios that I weave into the narrative that I give are multiple patients that I've put together to make the point that I'm trying to make about various situations that come up in the medical office visit that are memorable to me or that I wrote down. And then sometimes I've written them contemporaneously, and I've asked the patient, is this when I decided that I was writing a book, I've asked people, is this okay for me to put in the book? I'm going to take out identifying characteristics, and not once did a patient ever tell me no, because they knew that I was using that information for a book that I was going to publish for the world to read. Somebody added, always stretching myself to do and be available to others, always helping where and how I can. And so I will add that I do have a section in the book. It's called For the Ladies. And the chapter is basically about how women take care of everybody else before they take care of themselves, and how, if I had $1 for every time that I've had that discussion with a female patient about how she needs to start paying attention to how her health instead of everybody else's health. And somebody has commented, no good family roles models on eating. Yes, as a primary care physician, I often am teaching adults how to eat because they really have never been taught. And so I go into a lot of details in this book about how to eat. And I'm hoping that it was going to be so helpful. And so, how did I come to write all of this? By listening to my patients over the last 27 years. I'm actually a doctor who listens to my patients. And I started writing things down. And this is what the product of that. Somebody has asked a question, are there any race, gender, or economic class issues related to patients' candor with their personal care? Um, I would say that for people, whoever they are, if they are not used to coming to the doctor, they're distrustful of the medical establishment, which many people are for a lot of valid reasons. Um, Many people may not like to reveal many intimate details of their health and their medical history and what's going on in their life, physically and psychologically. But in the beauty of primary care is it's just not a one-time deal. The goal of picking a primary care doctor is you're having a relationship with this doctor longitudinally for many, many years. And so I think in my experience, once you get to know people, people become more comfortable over time. And the key is to encourage them to keep coming back, whether it's in person or virtually. And I can usually help the person break down those barriers so they can be more forthcoming about how they really feel. Because the more that you can tell your doctor and not leave anything out, not leave something out that you don't think's important, but that very symptom that you didn't think was important may be the very symptom that I needed to hear about to figure out what's going on with you. And someone asked, can you share a good story from your book? I certainly can. And so the story that comes to mind in my book is talking about cancer screening. And so I had a patient, a man who also his sister was my patient. his mother was my patient. And the father died from colon cancer. And so his sister got her colonoscopy, which is, if you don't know, colonoscopy, full colonoscopy for colon cancer screening is recommended for everyone now starting at age 45. And he just was not going to get this colonoscopy. I said, your sister's gotten it. And I wasn't disclosing anything he didn't already know. He knew his sister had gotten her colonoscopy, and his other brothers and sisters who were not my patients, they got their colonoscopies, but he was the only one who didn't get their colonoscopies. Unfortunately, all of his siblings had their colonoscopies at the designated age, which at that time, I believe, was age 50. So that's been a while ago. And their colonoscopies were normal. And so time went on, and he came into the office with symptoms related to the gastrointestinal tract. Well, at that point, it was recommended to get a colonoscopy to figure out what was going on. And long story short, he had colon cancer. So is that a good story? I think it's a story to tell because it is a story about patients, people being hesitant about getting certain screening tests, knowing family history. They fortunately knew, and their father told them about his colon cancer. And so they all knew that they had to get their colon cancer screening. And that was very important for all of them to do that as a family. And everybody in the family was trying to convince him to get this colonoscopy, and he did not. So that is a story from one of my patients that stands out in this book of looking at cancer screening, knowing family history, and people being hesitant to do certain things, get their blood drawn, have screenings, come to the doctor at all. So I'm hoping that this book will empower people and give people lots of information such that health and taking care of your health doesn't seem so daunting and scary. And I think the more people have information about how to navigate the healthcare system, how to navigate a doctor's visit, what you need to bring to your doctor so your doctor can help you the best way they can, the less scary these encounters can be, and the more you will be willing to be candid, as one of our guests mentioned, being candid with your doctor, because you've heard the term garbage in, garbage out. If you don't give your doctor all the information, we can't make the best recommendations for you going forward. And so those are my poll questions for today. So I hope it kind of gives you an overview of the things I discuss in the book. And we have been talking together for 40 minutes. So for a few more minutes before we end this wonderful book launch party, if anybody would like to ask a live question, if you could raise your hand, and my assistant can facilitate unmuting you so you can ask a live question. So we'll be able to hear your voice on this recording, but you don't have a video or a name on this recording. Anybody have a question to ask me? Here's your chance to ask the doctor something. No questions. If you don't want to come off, oh, here we go. We got a taker. Participant guest C.
Hi, Dr. Cole.
Hello.
You know me.
I feel like I'm on a talk show or something.
Oh, it's so nice to talk to you.
Oh, this is. What's your question?
So, for hyperparathyroidism,
Oh, good Lord.
what suggestions do you have just if you find that that may be the problem?
So first of all, full disclosure that this person who is asking me this question is a doctor. And she's been a doctor longer than me. And she already knows the answer to the question that she's asking me.
If I ask something simpler.
So hyper, first of all, everybody on this call is not a doctor. So I have to explain what is hyperparathyroidism. So first of all, the parathyroid glands are here. We have 4 of them. They're behind. Your thyroid glands are here, and your parathyroid glands, there's 2 of them on each side. And the main, keeping it simple, the parathyroid glands control the metabolism of calcium. And so calcium, why is that a big deal? Because if your calcium metabolism is off, you can be in a world of trouble. And so very often, how do you know if your parathyroid hormone is parathyroid glands are making too much of the hormone that controls calcium metabolism? Sometimes, the symptoms can be very mild or vague. And so it really takes an astute doctor to check that calcium level. And a lot of times, you're checking things on the chemistry panel, and then the calcium level is elevated. And then you can check other tests to see the cause of the calcium level being elevated. Also, well, you said specifically hyperparathyroidism. So that's my simple answer to that question. I'm not going to get into any more detail with that because that's too complicated for this webinar.
Thank you.
I'm gonna call you later.
Thank you.
And someone said, bought your book on Amazon today. Thank you very much. We got another, someone has their hand raised. Participant G. There, you're unmuted, participant G. What's your question?
Good evening, Dr. Benita Coe. My question is, what, if any, difference is there between hypertension in and of itself and intracranial hypertension?
Okay, I know who this is too. That's a good one. So hypertension, when we speak of classic hypertension, we're talking about high blood pressure that's we call systemic in the body. So pressure higher than normal in your arteries and your veins that's circulating through your body. Intracranial hypertension is a totally separate issue, a separate issue from high blood pressure going on in your body. So intracranial is when your blood pressure, well, not blood pressure, when the pressure inside the arteries in the brain is higher than it should be. And so intracranial hypertension has different causes. The workup of it is very different from high blood pressure that's in your body, in your system. Did I answer your question?
You did, but a follow-up to that is, would a lumbar puncture be a good thing to do?
So sometimes if we suspect that what we're evaluating is due to intracranial hypertension, the one way we find out actually what that pressure is inside the brain circulatory system is doing a lumbar puncture, because that's how we find out what the pressure is. And so that kind of evaluation is done by a urologist and in conjunction sometimes with an ophthalmologist, because sometimes the eye doctor can look in the back of the eyes and see the effects of intracranial hypertension. But the neurologist is the one who evaluates to see if you need a lumbar puncture or not, if they suspect that you may have intracranial hypertension.
Okay, thank you. I've had all that, but I'll be in touch with you on another time.
I'm sure you will.
Okay, bye.
And then we have another hand up, participant H.
Good evening, Dr. Ko. My name is Monica. Can you hear me okay?
Yes, I can hear you.
Okay, good. I was calling about cholesterol because I know that's one of the important things that we should monitor. And every year that I go see my primary care, it's always a little bit elevated. And so I wanted to know what are some ways that I can reduce my cholesterol to get it in a healthy range.
Oh, I got a whole chapter on that in my book. So, the primary treatment for, and I'm going to get to some of these questions in the chat before we wrap up. I don't want to go past 1 hour because I don't want to take up your time on your holiday weekend. Cholesterol. And so the primary treatment for high blood pressure, diabetes, prediabetes, and high cholesterol is improving eating habits. Keeping in mind that with all three of those things, having a strong genetic component can contribute. So you could eat perfectly and exercise perfectly and still have those issues. And so the first thing is eating plant-based as much as you can, at least getting rid of the cow, milk from a cow, cheese from a cow, leaving that cow alone, focusing on your fruits and your vegetables. If you're going to do meat, chicken, turkey, and fish. I have a lot of information in the book about foods that can help you lower cholesterol. I have some links for that. What I can tell you, there is a website that's peer reviewed. It's called Healthline, HealthLine. If you go, Healthline is an excellent resource for patients to read about all kind of things medically related, peer-reviewed articles, which means a medical professional wrote it and then a peer reviewed it to make sure that it's accurate. And there's a lot of information on Healthline that I actually use those links to give to my patients during visits or send messages with those links. There's lots of lists on foods to lower high cholesterol, foods to lower high triglycerides, and I have some of those links in the book as well. Getting that 150 minutes a week of cardio, moderate intensity exercise helps lower high cholesterol. Other things that help, and I have this in the book, chia seeds, flax seeds, hemp seeds. Those have all been shown to help lower cholesterol. And so I encourage people to try those things before we start talking about medication for high cholesterol. And one thing I will add, and this is detailed extensively in the book about how to evaluate cholesterol. Starting at age 40, the risk of heart attack and stroke goes up. So starting at age 40, your doctor should be doing what we call risk stratification by doing particular calculations, looking at your cholesterol profile, the total cholesterol, the LDL cholesterol, your HDL cholesterol, that's a good cholesterol and the bad cholesterol, bad cholesterol and good cholesterol, respectively, triglycerides, that's the fat in your blood. Doing that calculation, and if you have abnormalities, there are currently blood tests with biochemical markers that we're able to do very simply to what we call risk stratify you, as far as based on your numbers and your calculation and your markers, are you at risk for heart attack and stroke? And these are genetic markers that you're born with, and exercise and diet is not going to change. And then if you have abnormalities there, then there's further testing that we can do, things like coronary artery calcium scores, doing further what we call advanced lipid testing. So we have more tools in our tool belt to evaluate cholesterol in people, see who's at risk for heart attack and stroke, who is going to benefit from a cholesterol pill when diet and exercise is not helping. And so let me look at some of these questions in the chat as we try to wind up. How do you guide patients regarding nutritional supplements? Let me answer that first question. So I am not big on nutritional supplements at all. I encourage people to make the lifestyle changes that they should make to get the nutrients they need from food as much as possible. The nutritional supplement industry is a huge industry. I think much of it is unwarranted to spend a lot of money on nutritional supplements when you can get your nutritional supplements from food. Now, obviously, there are various medical conditions that can be caused or lead to nutritional supplements, nutritional deficiencies. Some of these deficiencies we have a test for, some of them we don't. And then what are your thoughts on creatinine and brain health? I'll be honest with you, I don't have any thoughts on that. That's something I would have to look up. I'm not quite sure if there's a correlation between creatinine and brain health. And then the next question, how can you recommend a good vitamin? I think I've kind of answered that one just now. I encourage people to try and get all their nutrients from food. Certainly, of course, you can take over-the-counter multivitamins, but there's not a whole lot of science behind doing that. Is vitamin D deficiency really a problem? Why is it related to everything? Well, I think I've kind of touched on that question. There are no current guidelines for checking vitamin D levels in adults. We check them, we overcheck them. I don't even remember when the whole vitamin D thing became a thing. Vitamin D is made in the skin through sunlight. Drinking milk does not really help in giving you vitamin D because vitamin D is added to milk. Milk does not come out of the cow with vitamin D in it. It's added. And you don't absorb vitamin D very well in things that have fat, like milk from a cow, meaning whole milk. So vitamin D deficiency becomes an issue in postmenopausal women when we start talking about bone health. Like I mentioned, there are many conditions where vitamin D is an issue, and a lot of times the specialists are checking vitamin D. But I try not to be checking vitamin D levels on everybody because there's no science behind doing that, and we really don't know the meaning of that unless you are a postmenopausal woman where that matters as far as bone health, and also if you have various medical conditions where vitamin D is important. Can I ignore my cholesterol level if the HDL is 50 to 100? Like I said, depending on your age, but starting at age 40, the answer to that more and more may be no. So the HDL is a good cholesterol and it's protective against heart attack and stroke when it's above the 60 to 65 level. So that's, especially if you're above age 40, that's where doing the, it's called ASCVD risk score. And I detail all this in the book, atherosclerotic cardiovascular disease risk score from the American College of Cardiology. It takes into account multiple variables, including that HDL. So having a good HDL above 60 to 65 may not balance out high triglycerides, a high HDL, or if you have genetic markers on your advanced lipid testing. So not necessarily. What is your opinion on GLP-1 drugs versus more traditional weight loss methods? I prescribe GLP-1 drugs and they work. They're not magic pills. All these medicines do traditional weight loss methods versus with respect to their earlier drugs that we use versus the GLP-1s. All they do is change your relationship to food. The drugs don't make you stop eating anything unless you decide you want to stop eating it. The most people who I talk, and I do a lot of weight loss counseling, and I go into detail about how to lose weight the traditional way in the book. In my book, I do not talk about medicine at all. Not once do I mention a medicine in this book. The best way to lose weight is change your eating habits. Get rid of the bread, rice, pasta, and white potatoes and sugar. That's the best way to lose weight. The drugs help people, and I do prescribe them a lot because if your blood pressure's up, your cholesterol's high, you're trying to lose weight, you're pre-diabetic, you're diabetic, you've already had a heart attack, your kidneys aren't doing too well. Sometimes when I meet people, they're at the point where their weight loss is going to be critical to them improving their eating habits. And so getting that weight off by using the medicine to help you change your relationship with food so you can eat a different way, I recommend it. Gifting your book to my family at Xmas. This is Dr. Janelle Nelson, dermatologist. Can your vitamin D, I'm assuming vitamin D, be too high? Yes, you can. A lot of people are doing this, taking vitamin D supplements for various vague reasons. You can have vitamin D that's too high. And is high B6, vitamin B6 a problem? High vitamin B6 is a problem, mostly probably from people taking vitamin B6 supplements. Is cancer related to vitamin D deficiency? I am not aware of any cancer syndromes that are related to vitamin D deficiency. And then I have a comment, fabulous work. Congratulations, and pink and green hearts. So it is now 7:58 Eastern Standard Time in the United States. And so I am going to wrap this up, and I'm going to thank all of you for joining me in discussing my new book, How to Help Your Doctor Help You. A guide for men and women. It's not just for women. This is for all adults. How to help you manage your health proactively. So I am going to share my screen and give you some more information that I would like to present to you. All right. Here we go. I started writing a monthly newsletter a little over a year ago. And so on the screen is the QR code to the monthly newsletter that I wrote in October. Let's talk about healthier ways to eat out. And so this is the QR code. This presentation is going to be on my website. And so you'll be able to look at this video on my website, which I think is on the next slide. But I just wrote the latest monthly newsletter yesterday. And so it's going to go up on my website. It's also, all my newsletters are on my LinkedIn page. If you just put my name in LinkedIn, you can see my profile on LinkedIn. Let's talk about staying healthy while traveling. And I love that picture that I just generated by AI. I have dabbled in AI making images because lots of people travel outside the country, and I have some easy to follow tips about how to maintain your health while you are traveling. And so here's information about the QR code to sign up for my monthly health newsletters. As I mentioned, you can see all of the newsletters that I've published on besthealthforyourlife.com. And then the other QR code is the direct link to see all of the new newsletters that I have put out for the whole world to read. On my website, on the page, you can see all my previous newsletter editions. And so thank you so much for joining me and making this a great book launch for How to Help Your Doctor Help You, a guide for men and women to manage health proactively. And so thank you for your participation and your congratulations and joining me on this exciting evening where I have released and poured out into the world my 27 years of information that my patients have given me, and I want to pour it out to you. So thank you for joining me, and everybody have a good evening.